channel. I hope you guys have been doing well. I think this is the last episode of antibiotics. After this episode, now we're going to have a special episode just to look on some of the questions, some of the summary, and also some of the case scenarios under which we can use the knowledge on antibiotics. So I want to thank you guys for being patient, for committing yourself towards this series, and I hope you guys have learned something. So today we are going to tackle the last section of antibiotics. By now we have looked at some of the key areas that antibiotics work on. We began by looking at the cell wall and looked at some of the antibiotics that work on the cell wall. We also looked at the cell membrane and looked at some of the antibiotics that work on the cell membrane. And lastly, now we are looking on antibiotics that work by interfering with the genetic makeup of the bacteria. And we looked at the folic acid pathway. We looked on the DNA integrity, some of the antibiotics that work by interference with the DNA integrity, the likes of metronidazole. We also looked at drugs that yesterday, I believe we looked at the drugs that target the key enzymes that are very crucial in the unwinding of the DNA, and these are the topomerase 2 and the topomerase 4. And we say that these classes are the fluoroquinolones, the likes of the ciprofloxacin, the norfloxacin, and the levofloxacin, and others. And I mentioned one of the key side effects when it comes to fluoroquinolones, and that is the tendon rupture. So for the chronic users of those who tend to use fluoroquinolones for long, you have to check on that. Then there's also QT prolongation. For those guys who use for the chronic users of the fluoroquinolones, especially those with the cardiac issues, we may have serious arrhythmias because these drugs tend to cause the QT prolongation. So you have to be very keen when administering these drugs to clients who have got cardiac issues. We also looked at the drugs that work by inhibiting the bacterial RNA. And here we say that for this class is very easy to remember because just think of RNA. The R stands for rifamycins or the rifampicin. Yeah, and here we say that one of the major indications of using rifampicin is for the myobacteria, and it's one of the regimen that is being used to treat the myobacterium tuberculosis. Then we said that for the clients who use this drug, they may complain that their urine is discolored. Tell them that this is normal with this drug because this drug tends to cause harmless orange urine color. Then also we looked at drug interactions. For clients who use this drug, they may have drug interactions. So you have to check at the medication history. If these clients are using the oral contraceptive, if these clients are using the warfarin, this drug may interfere with the serum concentration of these drugs. So that being said, today we're going to look now on the last section, still on the drugs that disorient or distort the genetic makeup of the bacteria. We're going to look on the last class, and these are the bacteria that work by the inhibition of protein synthesis. So we have a class of antibiotics that their major work is to inhibit the protein synthesis. So protein synthesis is very essential for the bacteria, especially for the bacterial DNA, because it's used to manufacture essential enzymes and proteins that are required for DNA replication or repair or regulation. So protein synthesis is very, very vital when it comes to the bacteria. So let me just put I've put a small row down here. I want to just elaborate on how the protein synthesis is very essential when it comes to the bacteria. So you can put here, for those who are writing, you can add that protein synthesis produces you can say produces key enzymes. So protein produces very essential enzymes. You can name them, such as, let's just name a few. This one that we mentioned yesterday, the topoisomerase, which is used for unwinding the DNA. We also have the helicase, very crucial enzyme. Also we have got the ligase. Some can mention just ligase is another one. We also have got the DNA polymerase and others. So there are some key enzymes that are very essential when it comes to DNA, and you can say which are essential, for coping, which are essential for coping. You can put a comma. Maintaining for coping, and maintaining bacterial genome, for coping and maintaining bacterial genome. So we have got these key enzymes that are very crucial when it comes to maintaining the genome of the bacteria. So if you interfere with the manufacture of these enzymes, it means that you are inhibiting the bacteria in all corners. So just to add a few, let me just put this should not be in bold. This is just a brief summary of what I'm going to discuss. So that's one of the essential points that you have to know. So another key point is that in bacteria, so the protein synthesis occurs on the ribosome, number one, and the ribosomes consist of major two subunits. That is the 30S, which tend to be small, and the 50S subunits. So the 30S, so let me just put here, let me add a point. Protein synthesis occurs on ribosomal subunits, and you can put there the 30S and the 50S. The 30S and the 50S ribosomal subunits. Yeah, and additional point, the 30S is majorly essential for maintaining the accuracy of the genetic code. That's one of the major use of the 30S. And you can put here the 50S essential, or maybe let me just put here let me make here it catalyzes or speeds up the peptide bond formation between amino acid between amino acids. So that's these are the key these are some key points that you have to note. So for this section, let me just put it in a small font, and I can put it in italics. Put it as number 9. I think that's better. Yeah. So that's one of the things that you have to note when it comes to, yeah. So protein synthesis, number one, it produces key enzymes such as the topoisomerase, the helicase, the ligase, or the DNA polymerase, which are essential for copying and maintaining bacterial genome. That's one key point. Then the protein synthesis occurs on ribosomal subunits, the 30S and the 50S. The 30S subunit is always majorly responsible for maintaining the accuracy of the genetic code, and the 50S it's always the one used to catalyze the peptide bond formation between the amino acids. So that being said, we're going to look on the two major classification or the broad aspects of these drugs. We're going to look for the ones that inhibit the 50S ribosomal subunit, and lastly, we're going to look on the drugs that work by inhibiting the 30S ribosomal subunit. So let's begin with the first one. So here we can look for those that target the inhibition of 50S ribosomal subunit, ribosomal 50S ribosomal subunit. Those work by targeting the 50S ribosomal subunit. Yeah. So let's begin with those that work by targeting the 50S ribosomal subunit. And the first one that seems so these drugs tend to be more majorly bacteriostatic because they work by inhibiting these enzymes, thereby infecting the growth of the the growth of the bacteria. So the first one here is the macrolides. The macrolides. And some of the drugs that belong to this group are the thromycins, like the erythromycin, I believe that's the spelling, erythromycin. We have the clarithromycin. Another one that you can mention here is the azithromycin. Yeah. So erythromycin, these are the major ones: erythromycin, clarithromycin, the azithromycin. Now, the mechanism of action, I think I've already explained. They work by targeting the 50S ribosomal subunit, and by doing this, they will interfere with the protein synthesis. And once you interfere with the protein synthesis, the bacteria will lack the protein that is required to manufacture the enzymes, which are very essentials for the DNA of the bacteria. So by doing that, basically you're preventing the growth of the bacteria. So that being mentioned, I believe you guys now understand the mechanism of action of this drug. So some of the indication when it comes to macrolides, they are very good when it comes to dealing with the aerobic and anaerobic gram-positive and some of the gram-negative infections. So you can put here they're very good for aerobic and anaerobic gram-positive and some gram-negative infection. And just to mention some of these infections are commonly the RTIs, the resp tract infections. Here, major one is the community acquired pneumonia. I'm very certain for those guys who have worked in the facility, you see our physicians giving the clients who have this type of pneumonia the azithromycin, which is a very good drug. Yeah, the azithromycin 500 milligram OD for around 3 days, etc. So some of these drugs are very good when it comes to dealing with the respiratory tract infections. Some are very good for STIs, especially for those with chlamydia. So you have also seen this drug being used to treat for those clients who have got chlamydia. So it's a very good drug also when it comes to dealing with some of the STIs. Another one, even skin, yeah, skin infections also is very good when it comes to dealing with. Let me just correct the spelling, chlamydia. So it's also good for skin infections, skin and tissue. Let me write here skin and tissue infections, skin and tissue infections. So it's also very good when it comes to dealing with the skin and tissue infection, especially those that are caused by the staph and strep bacteria. Yeah, so it's very good. Macrolides are very good for dealing with a very aerobic and anaerobic gram-positive and some gram-negative infections. Good for RTIs, especially for those clients who have got community-acquired pneumonia. For STIs, like those caused by chlamydia, the skin and tissue infections, like those caused by the staph and the strep genus staph and strep bacteria. Another key aspect here, it's always a good alternative for those clients who have got a penicillin allergy. So you can write here an alternative for patients with penicillin allergy. So it can also be used for those clients who have got allergy towards penicillin. So I believe till there you're together. So you've looked at macrolides, the first one. You've looked at some of the examples, the erythromycin, the clarithromycin, and the azithromycin. You've looked at some of the key uses of this drug. Very good when it comes to dealing with the resp infection. So very good when dealing with the STIs like chlamydia. Very good for skin and tissue infections. And it's also an alternative for those clients who are allergic to penicillin. So that being said, let's go to the side effects. So for the side effects here, the first one also obviously is the GI upset. Remember, this drug tends to interfere with the normal flora, and that's why you've got the risks of diarrhea, nausea, and vomiting that tends to occur. Other key thing here is the QT prolongation. Just like the fluoroquinolones, this drug also is a culprit in causing arrhythmias. The prolongation of the action potential, and this may tend to cause arrhythmias such as the polymorphic vitac or the torsades de pointes. So when using this drug, especially for those clients in ICU or those clients with cardiac issues, it's very good for them to be under EKG monitoring, so that when we see an abnormal arrhythmia, we can be able to stop the drug or change to other alternative drugs. So QT prolongation is another one of the common side effects for clients using this drug. We may also have there's also a condition that comes with using erythromycin, which is cholestatic hepatitis. Cholestatic hepatitis, and this is majorly associated with erythromycin. So till there, I believe you guys have an understanding when it comes to this drug. There are other side effects, but this one are the major ones that you have to know when it comes to using the macrolides. So I believe till there we are together. So that's one of the first class or one of the first class of drugs that work by the inhibition of the 50S ribosomal subunits. Another class of drugs that work by inhibiting the 50S ribosomal subunit. Here we have got the chloramphenicol. When you think of chloramphenicol, think of the gray baby syndrome. This is a song that we used to sing. Chloramphenicol, think of the gray baby syndrome. Okay, but we have a drug called chloramphenicol. This is a classification of a drug and also a drug on its own. Let me put it in green. So chloramphenicol, also chloramphenicol. I believe this is spelling chloramphenicol. Chloramphenicol. Is it an O? Chloramphenicol, I think that's the spelling. Yeah. So chloramphenicol is another drug that belongs to this those that act by inhibiting the 50S ribosomal subunit. And the indications here, one of the indications of using this drug is dealing with the bacterial meningitis. Why? This drug, just like the ceftriaxone, is very good in penetrating the central nervous system. So it can be effective when it comes to dealing with clients with bacterial meningitis. It's also good for enteric fevers. If you hear enteric fevers, think of the typhoid and the paratyphoid. Yeah, typhoid and paratyphoid. You'll be taught this when you do the communicable diseases. Paratyphoid. Yeah, it's also good for rickettsial infection. Rickettsial. Is that the spelling? Rickettsial infection. Yeah, rickettsia. It's very good against rickettsia. I can put there an L. Yeah. It's very good against rickettsia. Yeah, and also you can put here for broad coverage. It's good against anaerobic infections. Yeah, for those bacteria that grow in absence of oxygen. So it's a very good when it comes to dealing with also the anaerobic infections. Yeah, so these are some of the indications when it comes to using chloramphenicol. Now, when it comes to the side effects of chloramphenicol, the first one, gray baby syndrome. Gray baby syndrome. Someone is asking, what is this? So let me put it in units actually, because it happens in units. So this drug, the chloramphenicol, it tends to be found much. It tends to cause this syndrome in neonates, the gray baby syndrome. Why? In neonates, some of the neonates lack a very crucial liver enzyme, and that enzyme is called the glucuronil transferase. Yeah, so this liver enzyme, it's always very essential when it comes to metabolizing this drug. So for the infants who lack that enzymes, there will be elevation of this drug in the serum or in the blood, and this may lead to cyanosis or the circulatory collapse. So it may become toxic for those clients, for those babies or neonates who lack the enzymes, the liver enzyme called the glucuronil transferase. Yeah. So that's what you can take home. Let me just put here for those guys. So you can write here. It causes gray baby syndrome. Let me put here in neonates lacking liver enzyme called glucuronil glucuronide transferase. Yeah, so this enzyme is always very crucial when it comes to metabolizing this drug. And so if you lack that enzymes, then it will be hard for this glucuronide. I believe that's the spelling. Yeah, it will be hard for the client to be able to if a client or mostly neonates lack these enzymes, there will be elevation of this drug in the blood, and this blood may be toxic. It may cause a cyanosis and the circulatory collapse. So that's one of the major side effects when it comes to using this drug. This drug also causes bone marrow suppression. So watch for leukopenia, watch for thrombocytopenia, yeah, when it comes to using this drug. So that's all when it comes to chloramphenicol. Yeah. So another drug that work by targeting the 50S ribosomal subunits are the lincosamides. And here we can put there are two major drugs. One is very common, you guys have heard it, is the clindamycin. And another one that you may listen to or find is the lincomycin. Yeah. So the clindamycin and the lincomycin, these are another group of drug that work by the inhibition of the 50S ribosomal subunits. Now, these two drugs are they're majorly set apart when it comes to dealing with serious anaerobic infection, especially those that cause peritonitis. So you can write here, it's majorly indicated for serious anaerobic infections. Serious anaerobic infection. Very good when it comes to dealing with serious anaerobic infection, especially those that causes peritonitis. Another one, these drugs are also good when it comes to skin and soft tissue infection. So it's also good for skin and soft tissue infection. It's also very good for skin and soft tissue infections, especially those caused by MRSA, those caused by strep and other strep and staph bacteria. Yeah. So it's very good also when it comes to the MRSA, the strep and staph, those infections, those that are found in the skin and the soft tissue. It's also good. It can also be used for severe acne. For severe acne, and yes, used can be used topically. Like the clindamycin, very good one for the clients who have got severe acne. It may be used topically for clients who have got severe acne, like the clindamycin. Yeah, when it comes to the side effects of using this drug, one of the major side effects that you may come across is the pseudomembranous, that's the spelling, pseudomembranous colitis, and this is always caused by the overgrowth of C. difficile, Clostridium difficile, caused by overgrowth of the Clostridium difficile. So this is one of the major side effects when it comes to using the clindamycin. So when it comes to using the clindamycin or the lincomycin. Or the spelling, yeah, pseudomembranous colitis. Put the C. difficile, yeah. Okay, so that's the three example of the three classes of drugs that work by inhibiting the 50S ribosomal subunit. So another one that you have to mention, the last one, is the oxazolidinones. Oxazolidinones. So here, the drugs that fall under this category, number one is the linezolid, and another one also is the tedizolid. So these are the two major drugs that fall under this category, the linezolid and the tedizolid. Now, these drugs, they were strictly reserved for the MDR infections. With time, people tend to abuse the antibiotics. Yeah, someone has got just a cold, small flu, and the client buys the any antibiotics. So with the misuse of the antibiotics, these bacteria developed resistant. So various methods or various ways were devised in counteracting this bacterial resistance. And one of the drug classes that was that came by is the oxazolidinones. So we came up with these drugs with a major aim of dealing with the MDR infection. So these drugs were strictly reserved for serious MDR infections, serious multi-drug resistant infections. Yeah, just to mention a few. You've got the VRE. VRE is the vancomycin resistant, enterococcus. We also have got the MASA, obviously very common, the methicillin resistant Staph aureus, and also the MDR TB, the multi-drug resistance TB, yeah, which is very common for those clients. So on anti-TBs. So these are the major indications for using these drugs. So it tends to be used when there's a last option for those clients who have got serious resistance towards antibiotics. So side effects here we have a few. The first one is thrombocytopenia. So you have to monitor bleeding for these clients, yeah, because it will cause a low platelet count. It may also cause peripheral neuropathy, just like the isoniazid and the rest that tends to cause peripheral neuropathy. It may also cause something called the serotonin syndrome. It may also cause something called the serotonin syndrome. Especially this may become evident when taken with SSRIs. Yeah, if taken with SSRIs. So yeah. So for those clients who are on antidepressants, and one of the antidepressants that this class of the SSRIs, you have to monitor this syndrome and ensure that intervention is made in any eventuality that this syndrome occurs. So those are some of the side effects when it comes to using these drugs. Now, till there, you have looked at the drugs that work by inhibition of the 50S ribosomal subunit. Let's go to the next and the last section. We're going also to look for those that target. Let me put. Sorry, let me just move. We put here inhibition to make it inhibition of the 50S, and here inhibition of the 30S ribosomal subunit. Inhibition of the 30S ribosomal subunit. Yeah. So inhibition of the 30S ribosomal subunit. So the drugs that work here, we have got three major classification of the drugs that work by inhibiting the 30S ribosomal subunit. One is very common. You guys know it. It's the aminoglycosides. Aminoglycosides. That's the spelling. Aminoglycosides. Here we should have an O. Sorry. We should have an O here. So aminoglycosides. So example of these drugs that fall under this category, you have got the amikacin. We have the gentamicin. We also have the neomycin. We also have the tobramycin. And also the streptomycin. So those are streptomycin. So these are some of the drugs that fall under this category: the amikacin, gentamicin, which is very common, genta. You have the neomycin, also very common, the tobramycin, and the streptomycin. So I want to put a short note here. An NB. So one thing that you have to know: most of these drugs, they are always, they're highly polar, and they're not easily absorbed in the GIT. So in most scenarios, we always administer them parenterally. So mostly administered parenterally. So they're always administered either through the intramuscular route or the intravenous route. Yeah, so that being said, let's continue now. When you look on the some of the indications when it comes to using this drug, so the first one, this drug are always very good when it comes to dealing with severe gram-negative systemic infections like the septicemia or sepsis. So when the client has got septicemia or sepsis, and this sepsis, if you do the culture and you find that the bacteria that is causing this sepsis is a gram-negative bacteria, one of the major drugs that tend to work very much effective are the drugs that fall and are the drugs that are aminoglycosides. Yeah. So here you can put that they are very good against gram-negative, severe gram-negative systemic infection. And here you can put septicemia, and this sepsis. So that's one of the major indications. Then they're also used synergistically. They're used in combination with other drugs when it comes to dealing with gram-positive bacteria. So you can say synergistically for in treating or dealing or in treating. Let me put in treating gram-negative, gram-positive, gram-positive bacteria. And one of the major drugs that we tend to use, we always used in combination with cell wall agents like penicillins. So we tend to use them with penicillins when it comes to dealing with gram-positive bacteria. That's why that's why for those guys who have worked in a pediatric ward, you see expengenta. You see a client being given expen and gentamicin. So these drugs are very good when it's used synergistically, especially in dealing with gram-positive bacteria. Yeah, it's also good in skin infections. Very good against skin infection, especially the neomycin ointment. So like you can put here maybe the neomycin ointment, a very good ointment when it comes to dealing with the skin infection. Ointment, yeah. Yeah, we can also it's also very good against bacterial conjunctivitis. You also see these drugs being used when it comes to dealing with bacterial conjunctivitis. So these are some of the indications when it comes to using aminoglycosides. Think of the expengenta when dealing with the gram-positive bacteria like the strep and the staph infections. Think of the serious gram-negative systemic infection like the sepsis. We may see amikacin being used. So these drugs are very good when it comes to using. These drugs are very good when it comes to dealing with the gram-negative, systemic gram-negative, or you're dealing with gram-positive, but they may be used synergistically with the likes of penicillins or the vancomycin or others. So when it comes to the side effects of using this drug, one which is very common is the nephrotoxicity. So if the client is using this drug, check the RFTs, check the creatinine levels, check the BUNs, and if there's elevation, then this drug has to be stopped, or you have to look for another alternative. It may also cause ototoxicity. Another common side effect when it comes to using this ototoxicity. That's the spelling. Another one, it may also cause neuromuscular blockade. And that's why this drug is very dangerous for those clients who've got neuromuscular disease like the myasthenia gravis. So why is it dangerous? Because for the infections or the diseases that cause neuromuscular that are caused by neuromuscular blockade, it's always dangerous because it may paralyze the respiratory muscles, and this is interfere with the breathing of the client. That's why they tend to be very dangerous. So for this, I think it's always contraindicated in myasthenia gravis. So it's always dangerous for clients who have got myasthenia contraindicated, yeah, in myasthenia gravis. And you've got other side effects, but these are the major ones that you have to remember when it comes to using aminoglycosides. Think of the nephrotoxicity, think of the ototoxicity, think of the neuromuscular blockade that may come by using this drug, and the rest. So that's all about aminoglycosides. Another one that you have to discuss, which is very common, is the tetracyclines. So here I've got the tetracyclines. And tetracyclines, some of the example of the drugs that fall under this category, you have got the tetracycline. Yeah, we have the doxycycline. This is the spelling, doxycycline, doxy. You have the minocycline. We have got the tigo. Is it tigo or tige? Tige. The tigecycline. Yeah, and others. So these are some of the. This is another group of drugs that fall that work by inhibiting the 30S ribosomal subunit, the tetracyclines. Yeah, very common drugs that we come across in our healthcare facility or in exams. So what are some of the indications when it comes to using this drug? So the first indication of using tetracycline is very good when it comes to dealing with the atypical pneumonia. So very good against atypical pneumonia. You can also be used when it comes to rickettsial disease. Rickettsial disease. It's also rickettsial. The spelling of rickettsia, double T. The rickettsial disease. Another indication is very good for zoonotic infections. Zoonotic infections, the like of brucellosis. Yeah, very good for brucellosis. Yeah, brucellosis. It's and maybe also Lyme disease. I can put here Lyme disease. Yeah. Apart from the zoonotic infection, this drug can also be used when it comes to cholera. Vibrio cholerae, very good against cholera, and also it can be used for malaria prophylaxis. So the tetracyclines, they're not only antibiotics. They not only work against bacteria. Some may be used prophylactically when it comes to dealing with some of the parasitic infections like the malaria. So it's also good for preventing malaria, for prophylaxis against malaria. Very good drug. It's also good against cholera, Vibrio cholerae. Very good drug, especially the doxycycline. You have seen it being used when dealing with the cholera infection. I think also STI. Let me add here. It's also good against STI, especially those STI that are caused by chlamydia. So if a client has got chlamydia, this drug also may be used. It's very good against chlamydia and others. So that's all when it comes to sorry, the spelling here. Chlamydia, zoonotic infections. Yeah, so these are some of the indications of using tetracyclines. And one thing that you have to remember, there's some of the tetracycline, like the doxycycline, which is very common in today's market or today's world. Doxycycline is very popular drug that is being used today. You have to know that one of the things that you have to remember is that some of this drug, there's some rules that you are given when consuming this drug. Like the doxy, you're told not to consume milk products or the dairy products when using doxy. It may affect its absorption. So those are some of the things that you have to know when it comes to using these drugs. So when it comes to some of the side effects that you have to know when it comes to dealing with this drug, number one is the chelation. This drug tends to discolor the teeth. So why? Because they bind to calcium. They tend to bind to calcium. And when they bind to calcium, which I found also found in the growing bones and teeth. And that's why you contraindicate it in that's why it's majorly contraindicated in you can say in children that are let me say less than 8 years. Children less than 8 years, and also pregnant women, because these are growing population. Pregnant women, they've got a fetus that is growing, and the children are still growing, and this drug may bind to the calcium that is very essential in the bones and in the teeth. Another thing that you have to know, it may also cause hepatotoxicity. It's liver unfriendly, so that's have to know. It may also cause GI distress or GI irritation, causing the likes of the nausea, the diarrhea, and others. Other another side effects also. Let's ask photosensitivity. It may also cause photosensitivity as a side effect. So these are some of the indications that comes. These are some of the side effects that you have to note when you are using tetracyclines. So last but not least, another drug that is very essential here is the spectinomycin. Very rare drug, but you may come across the spectinomycin. Please differentiate between spectinomycin and streptomycin. These are two different drugs. The streptomycin here, it's under aminoglycoside, and the spectinomycin, it stands on its own, but their mode of action is very similar. They work by inhibiting the 30S ribosomal subunit, preventing the synthesis of proteins. And if you lack the proteins, actually it means you lack the enzymes, which are very essentials for the bacterial DNA. So the major indications here, this I think the major indications, number one, I can say this, it has got a very narrow clinical focus, has a very narrow, it's rarely used, so it's a very narrow clinical focus. And I can see it majorly used against gonorrhea. So it's very good against Neisseria gonorrhoeae. Is that the spelling? Yes, it's a very good drug when it comes to dealing with gonorrhea. So side effects here, it's always pain. It may cause pain at the injection site, so it's very painful when injected. That's why you should be very careful not to get an STI like gonorrhea. If you get gonorrhea, we have to inject you with this drug, and believe me, it's very painful. It may cause pain at the injection site. It may also cause nausea, like other drugs, very common. It may also cause fever and some chills. Fever and chills. Yeah, wow. Guys, we have done it. We have broken down bacteria. This series, it was all about antibiotic breakdown, looking at how antibiotics are used, an example of antibiotics, and on how and the reason why they are some are contraindicated in some population. So it was a very nice episode 6 on antibiotic breakdown. This is the last class on antibiotics. We have looked on all antibiotics, some of the common antibiotics that you may come across, be it amikacin, gentamicin, ceftriaxone, the flagyl, the metronidazole, all these drugs. When you come across it, you have to know the class of this drug, the indication of this drug, and the side effect of this drug. So this is a summary table that I've created during the entire series. I'm going to maybe make a PDF of it and maybe create a link in the comment section where you can just download the PDF and just pass through and see what we've discussed. It is a very long class. We began by episode 1 looking on the structure of the bacteria, and we say that the bacteria is very easy to kill or stop its growth. You just have to look some of the key areas like the cell wall, and we looked at the antibiotics that work on the cell wall, those that work by decreasing the synthesis of the peptidoglycan layer. These are the vancomycin, the physiomycin, which are very good against MRSA, and it is also good against the C. difficile, like the oral vancomycin. And the side effects, like the Redman syndrome, especially for vancomycin, if you administer it very quickly, it may cause the Redman syndrome. We also look at the drugs that work by decreasing the cross-linking of the peptidoglycan, the beta-lactam antibiotics, the likes of the natural penicillin, the benzylpenicillin, which are always administered parenterally, like the benzathine and the procaine. Also looked at the phenoxymethylpenicillins, the PenV, which are always given orally. And we looked at some of the side effects when it comes to using penicillin. We looked also at the anti-staphylococcus penicillin, the likes of the flucloxacillin, the nafcillin, the decloxacillin, and the ofcacillin, and the cloxacillin. Yeah. We looked at the aminopenicillin, the amoxicillin, and the ampicillin, and we say that these drugs are very good, but they're highly sensitive when it comes to beta-lactamase. And that being said, they're always given in combination with a beta-lactamase inhibitor, the likes of the clavulanic acid, the sulbactam. That's why you hear the amoxiclav or the augmentin or the unacin. So this drug are always given in combination with the beta-lactamase inhibitor. We also looked at the anti-pseudomonal penicillin, the likes of the peptazole, the ticagrelin, the mezlocillin, and the as low ceiling. We looked at the cephalosporins, the first gen, second gen, third gen, fourth gen, fifth gen, and here we basically focus on the ceftriaxones. Yeah, very good drug when it comes to dealing with the bacterial meningitis. Yeah, we also looked at the carbapenems. We looked at the meropenem, the imipenem, the doripenem, the ertapenem, the monobactams, the aztreonams. After that, we looked at the drugs that work on the cell membrane, the daptomycin and the colistin, very good drugs and very little drugs used as the last resort, but they're very toxic. Like especially the colistin, polymyxin A, very toxic drug, but very good drug when it comes to a last resort MDR. We looked at the genetic component, the nuclear component of the antibiotics and of the bacteria, and some of the antibiotics that work by causing chaos on the genetic makeup of the bacteria, the likes of those drugs that work by interference with the folic acid pathway, the sulfonamides like the sulfamethoxazole. You look at the trimethoprim, very good drugs. We look at the synergistic effect when it comes to using both the cotrimoxazole. We also looked at those drugs that work by interference with the DNA integrity, like the nitroimidazoles, the metronidazole, and the tinidazoles. We looked at the nitrofurans, like the nitrofurantoin. We also looked at those drugs that target the topoisomerase 2 and 4 in episode 4, episode 5, I believe so. And here we looked at the fluoroquinolones, the like of the ciprofloxacin, the levofloxacin, and the moxilofloxacin. We also looked at those drugs that work by inhibition of the bacterial RNA synthesis, the like of the rifampicin. Yeah. And today we have looked on those drugs that work by inhibition of the protein synthesis. And I've said that protein manufacture is very essential because the bacteria need these proteins to manufacture essential enzymes for the DNA. And by inhibiting this process, basically it means that you are interfering with the bacteria. And the drugs that work under this category are those drugs that, number one, work by inhibiting the 30S ribosomal subunit, and those that work by inhibiting the 50S ribosomal subunit. And the drugs that work by inhibiting the 50S ribosomal subunit are the macrolides, the likes of the erythromycin, the clarithromycin, and the azithromycin. We've also looked at the chloramphenicol, a very good drug, but think of the gray baby syndrome, especially when it comes to neonates. The lincosamides, think of the clindamycin and the lincomycin, very good drugs. Think of the oxazolidinones, the linezolid, and the tedizolids. Then lastly, the 30S ribosomal subunit, the aminoglycosides. Here I've got the amikacin, the gentamicin, the neomycin, the tobramycin, and the streptomycin. Very good drugs when it comes to dealing with the negative systemic infections, and can also be used synergistically in dealing with the gram-positive infections. That's why you have seen expengenta being used in a facility. But if you think of aminoglycoside, think of the side effects that comes by using it. Think of the client's kidneys. Yeah, it may be nephrotoxic. So check on the RFTs, yeah, the BUNs and the creatinine levels. It may also cause ototoxicity and the neuromuscular blockade. So it's always contraindicated for those clients who have got myasthenia gravis. Tetracyclines, think of the doxycycline, the minocyclines, and the tigecyclines. Very good when it comes to zoonotic infections like the brucella. Very good against cholera. Very good as a prophylaxis against malaria. Very good when dealing with STI like the chlamydia. But this drug tend to bind on the calcium, so it may affect the growing bones and teeth, and that's why it's always contraindicated when it comes to pregnant women and the children who are less than 8 years. Lastly, I've got the streptomycin, which has got a very narrow clinical focus, but it's very good when dealing with gonorrhea. But this drug causes pain at injection site. It may also cause nausea, fever, and some chills. So this was the series of antibiotic breakdown. There is a very wide topic. I believe some of the areas maybe we have not covered. I believe it's time we're going to discuss. So the next episode, it will be some case scenarios and some questions that come in NCLEX in our exams. For those nursing students that are doing the exams, pharmacology exams, we're going to have some sample questions and you can tackle together in the next series. And I believe that by now you guys have an idea of some of the common antibiotics that you guys use on your facility or you guys have come across in your exams or in your class. Thank you for the discussion. If you're new to the channel, please give us the thumbs like up, subscribe, share the message to those clients, for those friends of yours who think this class may help them. and we'll continue from here. It's been amazing for interacting with you guys. I believe that I've learned a lot since we began, and I believe the journey is extremely long, but we will walk this journey together for those students who are struggling in understanding the essential topics in class. Thank you for your time. Have a nice day. Have a nice weekend. Have a